Hey guys, here is a video on the chapter Ureter. So first we'll study about the measurements, course, parts and relations, then some of the sites of the anatomical construction, arterial supply, venous supply, nerve supply and clinical correlations. So first looking about the introduction about the ureter. So ureter is a narrow, thick-walled, expansile muscular tube which transports urine from kidney to the urinary bladder. As you can see, there is presence of right kidney here and left kidney here. So the ureter is a long muscular tube which transports urine from kidney, both of the kidneys, till the urinary bladder. The urine is propelled from the kidneys to the urinary bladder by peristaltic contraction of the smooth muscles by the wall of the ureter. This is a very important point. So the urine is propelled out from the kidney to the urinary bladder by the peristaltic contraction. Here there will be smooth muscles, so there will be peristaltic contraction of these smooth muscles. Moving on to the measurements of the ureter, the length is around 25 cm and diameter is around 3 mm. Now we'll look at the parts of the ureter. So first there is presence of two kidneys, that is right and left kidney. The right kidney is slightly lower than the left kidney because there is presence of liver above the right kidney. There are two ureter, right ureter, left ureter. So these two ureter meets or converges at the base of the urinary bladder. This is the urinary bladder. There is ureteric orifice where the ureter opens into the trigone of the urinary bladder. This is the trigone of urinary bladder. There is presence of prostate in males. Then finally it converges into urethra. Now moving on to the course of the ureter. Moving on, the course of the ureter. Before that, we need to know the ureter, whole ureter is divided into two main parts. The first part is called as abdominal part. The second part is called as pelvic part. So abdominal part course and pelvic part course. First point, course. It begins from the medial margin of the lower kidney. As you can see in this diagram, this is suprarenal gland present on the left and right side. This is kidney, right kidney, which is slightly lower than the left kidney. You can see the beginning of the ureter on the right and left side of the kidney. So ureter begins at the medial margin of the lower kidney. It begins from the medial margin of the lower kidney. It passes through the renal plexus. There will be renal plexus in this area, renal veins present in this area. It passes through the renal plexus medial to the psoas major muscles from the transverse process of lumbar vertebrae. There are four main posterior abdominal wall muscles. We know that is psoas major, psoas minor, quadratus lumborum and iliacus. So this ureter is passing medial. So see, you can see psoas major muscle here. This is psoas major muscle. The ureter is passing medial to this psoas major muscle, which separates it from the transverse process of lumbar vertebrae. We know the part that is transverse process of lumbar vertebrae. It is separating the psoas major muscle from the transverse process of lumbar vertebrae. Moving on, this ureter further continues and reaches in front of bifurcation of common iliac artery. So this is the abdominal aorta, which is formed by external iliac artery and internal iliac artery. Abdominal aorta is mainly formed by the external iliac artery and internal iliac artery, which combines together to form common iliac artery. So common iliac artery. So the point where there is bifurcation, that is abdominal aorta, is bifurcating into right common iliac artery and the left common iliac artery. So that point it converges in front, so in front of the bifurcation of common iliac artery, in front of sacroiliac joint. So then it further continues downwards. It is continuing downwards, backwards and laterally to the anterior margin of the greater sciatic notch. As you can see in this diagram, so there is ureter where it is passing through the bifurcation of the common iliac artery. It is passing in front of bifurcation of common iliac artery. Then it passes downwards, backwards, laterally near the greater sciatic notch. Laterally to the, this is medial side, this is lateral side of greater sciatic notch. It is passing laterally near the side of greater sciatic notch. Then it runs downwards obliquely and reaches the urinary bladder. It is passing through the ischial spine. Here there is ischial spine, and it reaches to the base of the urinary bladder in the lateral angle of the urinary bladder. It is also called as trigone of the urinary bladder. It is passing near the lateral angle of the urinary bladder and finally reaches the ureteric orifice, where that is nothing but the opening of the ureter. So we'll begin with the course once again. So as you can see in this diagram, the ureter is beginning from the medial margin of the lower kidney. It moves near the renal plexus. There will be renal nerve plexus here, medial to the psoas major muscle, which is separating it from the transverse process of lumbar vertebrae. It comes in front of bifurcation of common iliac artery and in front of sacroiliac joint. So it reaches downwards, backwards and laterally near the anterior margin of the greater sciatic notch. As you can see here, it crosses the ischial spine, obliquely reaches the urinary bladder and attaches around the lateral angle of the trigone, that is trigone of urinary bladder, near the ureteric orifice. So this is about the course of abdominal part as well as pelvic part. So I have written this in the written format. So if you guys want the screenshot or the written format fit, you can take the screenshot. So further moving on, parts and relation of the ureter. First, the ureter is generally divided into two parts. That is, as I have said, abdominal part as well as pelvic part. Each part is about the same length, that is 12.5 centimeter. So total it is 25 centimeter. So each part is 12.5 centimeter. The abdominal part of the ureter extends from the renal pelvis to the bifurcation of common iliac artery, whereas the pelvic part of the ureter extends from the pelvic brim, where pelvic brim is nothing but it is the level of bifurcation of the common iliac artery to the base of the urinary bladder. So abdominal part, we'll see the anterior and posterior relations of the abdominal part of the ureter. So as you can see in this table, here there is anterior relation and posterior relation of both right and left ureter. First we look after the right ureter anterior relations. It includes the second part of the duodenum, right colic vessels, ileocolic vessels, right gonadal vessels and root of mesentery. As you can see in the lower diagram, second part of duodenum, right colic vessels, which these are branches of the superior mesenteric artery, right colic vessels, ileocolic vessel, there is right gonadal vessel and root of mesentery. Whereas the posterior relation includes the right psoas major muscle and bifurcation of common iliac artery. Left ureter consists of the left colic vessel, sigmoid vessels, left gonadal vessel, that is left testicular or ovarian vessel, sigmoid mesocolon, and this is a relation of left ureter. Right ureter, left ureter. Posterior relation of left ureter includes the left psoas major muscle and bifurcation of left common iliac artery. The posterior relations is easy, that is right psoas major, here left psoas major, bifurcation of right common iliac artery and bifurcation of left common iliac artery. Further moving on to the sites of anatomical constrictions. This is very important. They'll usually ask it for 3 and 5 marks. So there are 3 main important sites for anatomical constriction. The lumen of the ureter is not uniform throughout and presents 3 constriction. There is presence of 3 constriction at the following sites. So we have to remember these 3 sites. First one is pelvic-uteric constriction. Second one is at the pelvic brim. Third one is the uterovesical constriction or uterovesical junction. Pelvic-ureteric junction, pelvic brim, uterovesical junction. First, we'll look after the first constriction. So, here are the 3 constriction of the ureter. As we can see in this diagram, first one is the pelvic-ureteric junction, pelvic brim, and third one is the uterovesical junction. Pelvic-ureteric junction is, by the word we can understand, it is between pelvis and ureter, that is renal pelvis and ureter. Second one is at the pelvic brim. So pelvic brim is the point where there is bifurcation of the common iliac artery, So third one is where uretovesical junction, that is when the ureter is passing inside the vesicle or base of the urinary bladder, trigone of urinary bladder. We'll see its theory now. So first one, beginning with the pelvic-ureteric junction, that is at the junction where the renal pelvis joins the upper end of the ureter. It is the upper part of the constriction which is found approximately 5 cm away from the hilum of the kidney. So the second one is at the pelvic brim, where it crosses the common iliac artery. Third one is at the uterovesical junction, that is where the ureter enters into the bladder. Portion of the ureter between these constriction shows spindle-shaped dilations. These constricted segments of the ureter are the sites of arrest of ureteric calculi. So what is ureteric calculi? That is the site for the deposition of stones in the ureter. Further moving on to the arterial supply, the ureter derives its arterial supply from the branches of all the arteries related to it. So there are some important artery. So if this is the renal artery, so the ureter is mainly supplied by the 3 parts. So like consider it as upper part of the ureter supply, middle part of ureter supply and lower part of ureter supply. First, upper part is mainly supplied by the renal as well as gonadal artery. Middle part is supplied by the direct branches from aorta, internal iliac and vesical artery, that is superior vesical and inferior vesical artery, whereas the lower part is mainly supplied by middle rectal as well as uterine artery. Upper part is by renal and gonadal, middle part is by direct branches from aorta, internal iliac, superior and inferior vesical. Lower part is mainly from the middle rectal as well as uterine artery. This is the arterial supply. By considering the veins, same thing, but you have to add veins instead of artery. Renal vein, gonadal vein from the upper part, direct branches from the inferior vena cava, not aorta, internal iliac vein, that is for the middle part, vesical, superior and inferior vein, middle part. Lower part is supplied by middle rectal veins as well as uterine vein. The lymphatic system includes the lateral aortic and iliac nodes. Some other lymphatic drainage includes the lumbar nodes, celiac nodes, hepatic nodes, common iliac nodes, external iliac as well as internal iliac nodes. These are some of the extra lymphatic nodes present in the ureter. Nerve supply, it has 2 supplies, that is sympathetic supply as well as parasympathetic supply. Sympathetic supply of the ureter is mainly derived from T12 to L1 spinal segment. Parasympathetic supply of the ureter is mainly derived from the S2 to S4 spinal segments. Sympathetic supply is through renal, aortic, hypogastric plexus, whereas parasympathetic supply is through pelvic splanchnic nerves. So nerve supply is quite important. See, there is sympathetic supply as well as parasympathetic supply. Sympathetic supply is from T12 to L1 through the renal, aortic and hypogastric plexus, whereas the parasympathetic supply of the ureter is derived from S2 to S4 from the pelvic splanchnic nerves. Some of the clinical correlation includes the identification of ureter, ureteric colic, mobilization of ureter, injury to ureter. Some of the clinical correlation of the ureter includes ABC. First, when the pain occurs from the upper ureteral obstruction, it is mainly in the lumbar region, that is from T12 to L1 vertebra. When the pain occurs from the middle ureteric obstruction, due to middle ureteric obstruction, it mainly occurs in the inguinal region, scrotal region and mons pubis in female near L1 to L2 vertebra. When the pain occurs from the lower ureteric obstruction, it mainly occurs in the perineum area, that is from S2 to S4. When there is injury to ureter, so there are some dangerous sites. This is very important in the clinical aspect side. First one, the point where the ureter crosses the iliac vessels, so that is where there is bifurcation of the common iliac artery, pelvic brim, that area. Second area is near the ovarian fossa. Third area where the ureter is crossed by the uterine artery, which is the most dangerous site. This is very important. So first, where the ureter is crossed by the iliac vessel. Second, in the ovarian fossa. Third, where the ureter is crossed by the uterine artery, which is the most dangerous site. And fourth is near the base of bladder. So that's it about this video. Hope you have understood. So please do like, comment, share, subscribe. Thank you.